Having cancer and undergoing cancer treatment can be tough on just about every part of your body, mind and soul. It's a tough journey, so you need to look after yourself.
Emotional well-being means acknowledging that feeling emotions, including fear, uncertainty, isolation, grief and loss, are normal in your situation, and allowing yourself to experience and express these emotions. Identify your personal strengths in coping with a life crisis such as cancer. Use meditation, relaxation, exercise and other enjoyable activities to manage stress and to help yourself feel better. Ask for help from a health professional when you need to, and remember to listen to your body.
Physical activity is an important part in a person's life, especially after having received surgery and chemotherapy for a cancer. Women with ovarian cancer will find that they will do a lot better if they can get out into the fresh air and do some sort of exercise during the week or on a weekend whenever they're free. But again, they need to be careful that they do it in accordance with what they feel is manageable, and also with some guidelines maybe from a physiotherapist and their oncologist.
I do try and increase my fitness. I am much fitter now than I was before I had cancer, when I was working a very demanding job. I try and get to the gym a couple of times a week and walk, and when I'm feeling well I really try and build my fitness. I'm sure that it helps. In fact, it's proven that it helps.
Get out there and have some social activity with your friends, with your family, and some social clubs that you used to participate in. It's going to help you feel more positive, more alive and more able to cope with the things that are going on.
Eating and food can be much less appealing for many reasons during cancer treatment: nausea, decreased activity, changes in mood. It's really important to maintain good nutrition through your treatment, which will maximise your journey through the treatment and also your well-being. We recommend eating a variety of fruit and vegetables every day, whole grain cereals and breads often, and fish at least 3 times a week. If you're finding it difficult to eat 3 meals a day, one alternative can be to eat 5 or 6 small meals a day, and snacking frequently on fruit, vegetables, healthy dips and healthy biscuits. It's always important to limit alcohol intake, and certainly when one is going through cancer treatment, moderation is the key. It's also important to limit processed foods, as these tend to be low in nutrients and high in fat, salt and sugar.
Early menopause wasn't something I expected to deal with before I was 50. That's what the literature said, and that's what your mothers and grandmothers and people before you had said. Now, I had had the hot flushes, and there was things that women don't like to talk about, like dry vagina. And so once I spoke with my gynaecologist, I had some advice on trying some natural therapies. So things like eating lots of soy. And that wasn't effective enough, so I went back to spoke to the gynaecologist, who then put me on a low-dose hormone replacement therapy, and that's been wonderful. Hot flushes are completely gone, and just living a normal life now.
All women who've gone through menopause, whether it's in their 50s or before that for reasons such as cancer treatment, are at increased risk of cardiovascular disease and osteoporosis. You can help decrease this risk by changing certain things in your diet, such as making sure that you get adequate calcium. We recommend 3 serves of calcium per day. For example, 1 glass of milk, a small tub of yogurt and a piece of cheese. If you're unable to eat dairy because you're lactose intolerant, speak to your doctor about what other options there are to make sure you're getting enough calcium. Vitamin D is also important. You should go to your doctor and get your levels checked. If it's low, you might be advised to increase your sun exposure or even take a supplement. And weight-bearing exercise will also help promote strong, healthy bones, so that includes walking, running or weight training. It's common to feel a wide variety of emotions when you go through a trauma like an ovarian cancer diagnosis. These can include sadness, anxiety and sometimes depression. It's really important to talk to someone that you trust about these feelings, such as a friend, family member, even your GP. You can access support networks through Ovarian Cancer Australia. And if professional help is required, your GP can easily arrange counselling or psychology.
I believe as a direct result of my cancer, I developed depression. What I did was to get some antidepressants. They've kicked in and I now feel as good as I ever have.
How you're feeling emotionally will play a huge role in your general well-being through ovarian cancer treatment. creating a positive environment and utilising your support network will greatly assist in your recovery. Many women with ovarian cancer are interested in exploring complementary therapies. These can include massage, acupuncture, yoga and meditation. While they aren't intended to cure cancer, they can assist greatly in the person's wellbeing and also managing side effects from the conventional treatment. It's really important to let your doctor know if you are interested in exploring these complementary therapies, as their role is to make sure there's no interactions or adverse effects from the complementary therapies.
There are some natural and complementary therapies that can interfere with medical therapies that need to be discussed with your GP and oncologist before commencing them. They can cause some unwanted side effects in combination with your chemotherapy. So it is important that GPs and oncologists are aware if you are looking at pursuing these types of therapies.
I've had a lot of massage and reflexology and a range of other supports. I look at Tai Chi and any other sort of things that will help you to still your mind and just rest your mind from the great worry that a cancer diagnosis brings to you.